Welcome back. Today we welcome Andrew Naparella, Vice President of Medicare and Individual Market Sales from our sponsors at Univera Healthcare. Thanks so much for joining me, Andrew.
Thanks for having me. Great to be with you.
Of course. We love having you here, especially when we're talking about important topics that I know that our viewers care about. So let's start off by giving some important tips of things to look out for when choosing health insurance.
Sure. It's a very busy time of year. Medicare open enrollment actually just started on October 1st, and people can start making their plan changes on October 15th. So lots of changes this year compared to other years just around the industry. So there are many things that people are going to keep in mind as they evaluate their options. The first is really, are their preferred providers and facilities that they utilize, are they participating with the plan? Mm-hmm. Similar, they're going to want to look at their prescription drug coverage and make sure that their drugs are covered by the plan. The cost is also very important. So they want to look at the total cost share, which that might include things like their premium, but also any deductibles and all the cost shares for the different services that they might utilize. People who travel, they want to also consider that when they're evaluating their plans. So typically emergent and urgent care are covered no matter where you go, but if you travel, if you're a snowbird, like we have a lot of those in Western New York, or if you just want to have access for places outside the area, you want to make sure that your coverage is going to travel with you.
Yeah.
Lastly, you're going to want to make sure that you're taking advantage of any financial assistance programs that are available, and there are a few. So there's a low-income subsidy, and New York State has the EPIC program, which many people qualify for, that help limit their out-of-pocket costs.
Okay. Great tips there, things to look out for. And let's get into what are some things that people don't think about when selecting a health insurance plan that could make a difference or important to take note of now.
Sure. Well, there are a number of things. Typically when you think about the premium and the cost shares, those are very front of mind for people. But also there's a lot of supplemental benefits that they should consider as well. Things like dental coverage, vision, hearing, fitness. In recent years, we've had things like telehealth become more important for people, so they can get some advice and some help without having to leave their home. Maybe in the winter in Buffalo, sometimes that comes in handy.
Oh, for sure.
And lastly, there are benefits that are available through a lot of plans, like nutrition or dietary supplements that people can give us a call and get some help in evaluating their diet, making sure they're staying healthy. We hear the term "food is medicine."
Right.
We're a sponsor and really support that initiative. So there are a lot of things available within people's plans that they should take advantage of to make sure they're keeping themselves as healthy as they can.
That's right. Viewers know I always talk about my grandma, Patricia Glover. She loves her silver sneakers. She has all these gym memberships.
There you go.
She works out more than me, so she's loving it. Okay, so what does it mean when you say Univera Healthcare is right here for you? That's kind of your slogan.
That's our slogan, that's our mantra, and it was really a great experience. I was part of a group that helped evaluate what do we want that to be. And how we came up with that was really feedback off of our employees and then talking to our members and the employer groups that we work with and saying, when you hear Univera, what do you think of? How do we show up for you? And that was really what kind of rose up to the top, was right here for you. So what that means is that we're very proud to be a Western New York company. We're local. All of our staff and our decisions are made here. We're a part of the community. We're not going anywhere. Even during AEP in a confusing time, we're here to help people, and we're going to step up during those opportunities where we can help them.
Andrew, it's very clear and evident that you love what you do working at Univera Healthcare. Tell us more about exactly what you do and what your favorite part of your role is.
I really do. The company culture really is fantastic, and really what I enjoy the most is seeing the impact that we have in the community and the individuals that we work with. So the team that I get to work with, they help people in the individual markets. So evaluate if they're on the exchange, or this time of year during Medicare, evaluating all their options, which can be very confusing, especially when there are changes, if there are plans being discontinued in the market or benefits changing. It's very confusing for a lot of people. There's so much happening. So being able to help them find the right coverage and have confidence and clarity in their plan, it really means a lot to them. I see the thank you notes that they send, and really get to see that feedback, which is great. We partner with a lot of community-based organizations. We just had a summit where our room was filled in our headquarters with people that were there just to network and talk about funding options and things like that. We have a health equity award where we help fund organizations as well. And lastly, what I think is really validating for all of us is the fact that we're making a difference. All of our lines of business are growing, whether it's from employer groups or on the individual side. So the work that we're doing is really resonating with people, which is really validating for us.
Alrighty, well, thank you so much for coming in and speaking so passionately about what you do and giving great tips to our viewers. And listen, if you need help selecting the right health insurance plan for you, you can visit our sponsors at univerahealthcare.com. Thanks again for coming in, Andrew.